Dr. Zinman has had a massive impact on that list of things that we now know can change the course of someone living with diabetes. His impact on diabetes management really cannot be understated.
I've always been a curious person, and so when you're curious and you're interested in science, you want to read more, do experiments to try and understand the underlying mechanisms responsible for the observations.
Diabetes is a metabolic disorder that arises when we are unable to maintain our blood sugar. And that can be for two common reasons. We're not making enough insulin, or the insulin that we're making is not acting properly.
So the Diabetes Control and Complications trial addressed a critical issue. In 1982, 83, it was unknown why people who have type 1 diabetes, who feel well on insulin injections, develop long-term disabling complications.
So prior to the DCCT, people living with type 1 diabetes were on insulin, because without insulin, they would become very ill. But what level of glucose target to aim for was not known. And it was not known whether you just needed some insulin on board and that was good enough, or we actually should try to give you insulin a bit more like normal physiology and try to get closer to normal. We didn't know. After DCCT, completely changed. Recognition that yes, taking insulin multiple times a day, trying to get the glucose levels closer to normal makes a difference.
He's also had similar contributions in type 2 diabetes. He contributed to some of the pivotal trials, and most notably, the first trial to show that the diabetes drug could reduce mortality, i.e., a drug for treating diabetes, saving lives.
We are now in the era where diabetes therapies not only treat the diabetes, but they have added value in reducing the long-term complications of diabetes. And that's what people suffer from and die from. Not diabetes, they die from the complications of diabetes.
If one were to try to put numbers to how many lives have been affected by Dr. Zinman's work, I think you could literally say every person who currently lives or did live with type 1 diabetes since the publication of DCCT has been impacted.
In 2007, the University of Toronto Department of Medicine introduced a new award recognizing outstanding mentorship. Dr. Zinman was nominated for that award by myself and my colleague Tony Hanley, and he was the inaugural winner of this award at the University of Toronto.
Everything that Bernie has done has in part revolved around not only his tremendous scientific knowledge, but his people skills. Individuals like Bernie, they're happy to work with him. He brings out the best in people. They work harder when they're with him. In the end, that produces amazing results.
What Dr. Zinman brings is combined clinical medicine and research in diabetes for 40 years, and in doing so, touched pretty much every element of diabetes care and research in Canada and globally.
Legendary clinician scientist whose research transformed the understanding, management, and treatment of diabetes around the world. Canadian Medical Hall of Fame laureate, Dr. Bernard Zinman.